What might drive a surge in COVID-19 cases? That big question and more with Professor Guido David, a fellow of OCTA Research. Professor David, welcome again to The Big Story.
Hi, good evening, Robbie. Long time no see, so I see I'm back.
Oh.
We might have something looming on the horizon.
Okay, long time no see, that's true. But also in the past, when we see surges, not just here, but also in other countries, India, Thailand, Indonesia, it's driven by religious festivals and election season. We're gonna have both. I mean, if we get this perfect storm, what do we mean by surge?
Well, we might get the perfect storm, Robbie, and there are many a confluence of factors. Na mentioned mo yung iba. So far, campaign sorties haven't caused a surge yet. And then yun nga, we might have the religious gatherings, which may or may not add to the effect. And again, we're stressing that this is just a possibility. Pero one of the other factors is yung waning immunity natin. And this has been studied by other researchers all over the world. So after 3 months, nagsisimula na nagkaroon ng waning immunity, decreasing antibody levels. So if our previous surge happened noong January, then if we count 3 months, that's around April, that's when magsisimula na magkaroon ng decreasing antibodies yung ibang tao. Not everyone, because not everyone has the same biological response, pero it's just possible na if enough people have waning immunity, baka magkaroon na naman ng increase in cases. It might not be, and it's most likely not going to be as bad as what we saw in January, but there could still be an increase in cases.
Yeah, waning efficacy is one thing, and then not getting booster shots is another thing. I mean, government is challenged on that front as well, just trying to convince people that 2 doses is not enough. You are going to have a booster dose taken both together, waning efficacy and reluctance of people to get their booster shots. What does that all add up to?
Yes, Robbie, and that's a good point kasi this possible surge, kaya nga sinasabi natin possible, it could be prevented if enough people get the boosters kasi the boosters will counter the waning efficacy of the vaccine. So pag humihina na yung protection natin, if we get the booster, studies show na it could increase our protection by maybe double. So it will double our protection against infection and against severe COVID. So malaking matutulong yan. And of course, we still need to follow minimum public health standards to avoid this possible surge. So that's why we're saying possible. If we work together, we may be able to avoid this surge. Ngayon, that's barring a possible new variant of concern. We're already seeing a lot of new subvariants and recombinants. Na-mention kanina ni Greg sa report niya na yung XE, we're monitoring that closely because that, or maybe another one could be the next big threat to us.
Okay, Professor David, maraming salamat po. That was Professor Guido David of OCTA Research.